Well, good morning, everybody. My name is Bill Considine, and I have the privilege of serving as the chairman of the board of the Austin Biomedical Institute. And on behalf of the board and all the players within our institute, I'd like to welcome you to the offices of ABIA, because this is a very special occasion. And as a matter of fact, it's a milestone event when you think about the work that has transpired with the Institute over the last couple of years. We're here to share with you and to announce the formation of the first company that's come out of the work of ABIA, Apto Orthopedics. You know, as I stand in front of you, I have to share with you the excitement that I feel inside. One, as a partner within the Institute, Akron Children's was one of the founding members, and being the president of that organization for 33 years has been a real privilege. And then when you see what working together with other organizations here in town can mean to our community, it doesn't get any better than that. In addition to that, being able to stand before you and talk about Apto Orthopedics, knowing that one of the principles of that is a position at Akron Children's even takes on additional meaning. So forgive me if I appear too enthusiastic. I would also like to, though, recognize the partners of the Austin Bioinnovation Institute, because without the partners, we wouldn't be celebrating today. We wouldn't be connecting in a very collaborative way to advance the spirit of this community and the prosperity that we all want to make sure is part of our hometown. The Austin Bioinnovation partners are comprised of the University of Akron. We have Dr. Luis Parenza with us here in the front row. Also comprised the SUMA Health System. Our colleagues over there have been very, very active in the development of ABIA. Akron General Medical Center and their CEO, Vince McCorkle. I thought Vince was going to be here. Tom Strauss, who's the CEO of SUMA, is out of town today, but he is here in spirit, I can assure you of that. The Northeast Ohio Medical University, again, a key player of ABIA, and their president, Dr. Jay Gershon. Jay's on his way to Colorado, but again, he's here with us. We were with him at dinner last night, and we were talking about today's program. Also need to acknowledge our colleagues at the Knight Foundation. We have Jennifer Thomas with us here in the first row. You know, without the Knight Foundation and their belief and the vision we shared with them about 3-4 years ago, again, we would not be here. And I also need to acknowledge the wonderful partnership we've developed with our governments, both the city government with Mayor Plasquelik, our county government with Russ Pry, and the state of Ohio, and the way that they have listened to what we have wanted to advance and embrace that vision and been partners as we've moved forward. There are a few other folks that I would like to acknowledge that are with us today. We have Max Blackman from Senator Brown's office. Max is right here. Senator Brown, again, has been in this room with us, has brainstormed, tried to figure out ways that we could attract additional dollars and really get our message out to a broader constituent group around this country. We also have Rick Rebideau from the Chamber. Again, in terms of partners, our Akron Chamber has been with us from day one and is out there really helping us tell the story. Chris Couples from Tim Ryan's office is also with us. And again, Tim Ryan, Congressman Ryan, has really believed in this from day one. And not only do they believe in what we do, they challenge our thinking, and they really work with us to try to take our work to the highest level. A few words about the power of collaboration, because that indeed is what the ABIA is all about. And it's through that power of collaboration that we are really trying to transform our community and make sure that Akron becomes known as the epicenter for patient innovation and commercialization. And when you hear about Apto Orthopedics today, I think you'll agree with me that we're talking about something that is launching us towards that epicenter of patient-centered innovation and commercialization. How did that all happen? When we came together with the ABIA and the partners, sat and talked about what we wanted to do, we did set some fairly aggressive goals in terms of what we wanted to develop. We knew through working with the city that the whole biomedical corridor held promise. And to make that promise turn into reality, we had to go to work. not as individuals, but as a team. And within that team, we have been striving to create an ecosystem that both encourages and supports the scientists that are part of our organizations. And scientists such as Steve Fenning and Todd Ritzman can tell you how important it is to have an infrastructure around them when they come up with a good idea that can be supported and then flushed out to be brought to a level of actually a product that can be commercialized. That's what we're here to talk a little bit about today, because indeed that's what's happened. We are building that infrastructure in this town. We are building an excitement around being an entrepreneur in the area of patient care, patient-centered care, and innovation that can be tied to that. And we are just so excited about it, being able to announce that through the work over the last couple of years, two of our stars, Steve Fenning and Todd Ritzman, have come up with a concept that has now evolved into Apto Orthopedics. We're hoping that Apto Orthopedics is going to launch initiatives here in this community that are going to bring dozens of other products like this to our community. And again, help us achieve that goal of distinctiveness. Distinctiveness in terms of what we mean relative to building relationships with the families that we're privileged to serve and coming up with new and better ways to care for them. Now, one of the other components that we're very proud of is being able to bring talent to our community. Dr. Parenza is always talking about the need for talent attraction and talent retention. And one of the objectives of ABIA was to do just that. And not only to attract talent, retain talent, but also uncover talent we already have here in this community and bring that to a visibility that others can see, not only here in this community, but around the world. And indeed, that is occurring. Well, relative to talent attraction, right out of the box, we knew we needed a CEO and president of this group we formed called Austin Bioinnovation Institute. And we did find a man by the name of Dr. Frank Douglas. And I have had the real privilege of working with Frank as chairman of the board, and he is our CEO and president for the last several years. And I have enormous admiration for this man's intellect, but even more importantly, admiration for the way that he brings people together and has the ability to bring the best out of folks and to challenge your thinking and cause you really to go to another level. Frank is, for 3 decades, developed a reputation not only in this country but around the world in the area of innovation, pharmaceuticals, medical devices, and the like. And he has brought that expertise and talent here to help us with ABIA. And I know that Dr. Fenning and Dr. Ritzman would both tell you that they wouldn't be sitting here without the encouragement and support that came from our Dr. Frank Douglas. So with that, please put your hands together and welcome Dr. Douglas to the podium.
Thank you, Bill. Mayor Pasquale, Executive Russ Fry, Dr. Parenza, Ms. Thomas, and Mr. Blackman, colleagues, friends. It's an exciting day. Today we are seeing the first bud of our patient-centered innovation and commercialization tree of innovation. It's a bud. And let me move on this analogy a little bit. What we do is similar to what a farmer does. A farmer has two things. A farmer has the soil and the climate. And the farmer must decide what types of seeds to plant in that soil that would be congruent with the type of soil and the climate that he has. We do a similar thing. The farmer can't do anything about the climate. He can do something about the soil. We do the opposite. We are given the soil and the assets. We can do something about the climate. So we started off by building, and we're continuing to build, our climate, which we call a collaborative innovation ecosystem, as mentioned by Mr. Consular. That's our climate. And within that climate, within this ecosystem, we planted a number of seeds. We started with our collaborative research development projects, which was headed by Dr. Walt Horton and administered by Sean. And those development projects were intended to give a kickstart to developing collaboration across the institutions, and also to develop projects which will create data, become seed-type projects that would enable us to apply for NIH, NSF grants. As of today, we invested $800,000 in those seed projects, which have leveraged about $19 million of submissions for projects at the NIH, NSF level. We also looked at how we should really bring forward our seeds, our ideas. And so we have things like the Synergy Seminar, structured invention sessions, the bioinnovation courses, etc. And that was seen nationally as a real model. And so together with the University of Akron Research Foundation, the US Department of Commerce, along with NIH and NSF, granted us one of 6 in the country, one of 6 I6 awards, because they recognize the importance of the ecosystem that we were building. It went beyond that. Having gotten that award, we were approached by Anish Chopra at the White House, who simply said, "Frank, have you thought about frugal engineering?" Short story. Within a year, we put together a multi-university industry collaboration, had a summit, released the white paper, which resulted in a congressional briefing that was hosted by Congresspersons Eshu of California, Paulson of Minnesota, and Betty Sutton of Ohio. That was in November 16th. The Kauffman Foundation came forward and said, this is indeed breakthrough type thinking. We want to be part of this. They participated in a congressional briefing and in fact are sponsoring a conference here in Akron in value-driven engineering and US global competitiveness, which will be held on April 23rd, 24th here in Akron. Again, recognition of the ecosystem that we are building. The value-driven engineering, and you will see this, the value-driven engineering has helped to shape our thinking. And this bud, Apto Orthopedics, is our first example of a company that will follow value-driven engineering. And Dr. Todd Ritzman, and Dr. Benning will comment on that. But let me say the following. Value-driven engineering has caused us to think about patient-centered innovation and commercialization in a special way. We've become very familiar with the thought, bedside to bench to bedside. But think about it. We don't want our patients lying in bed. And we want to go very rapidly to product. So under value-driven engineering, the paradigm we're using is patient to prototype to patient to product. Patient to prototype to patient to product. And you will see that evidenced in Apto Orthopedics. A final comment about the ecosystem that we've been developing here. We were able to attract the FDA to pay us a visit. And they were very impressed. They were impressed with the technology and the science and scientists we have, particularly in the College of Engineering and Polymer Science at the University of Akron. But as they sat there, and Jeff Shuren, Dr. Jeff Shuren, the director of the Center for Devices and Radiological Health, said the following to me when we met, and he finally told us that indeed the FDA will be doing a first-time collaboration in this area of biomaterials with ABIA. He said the following. What impressed us was not only the scientific and technological strength, but it was being done in a context, if you like, an ecosystem, in which the regulatory and clinical implications of the scientific results will be understood and appreciated. And that's why we're doing the collaboration. That's why we've done this ecosystem. The Center for Disease Control looked at what we're doing in the area of accountable care communities, and again saw this ecosystem and granted us a $500,000 a year grant to work together to really transform the community. Today is a very special day, and I would like to introduce Dr. Todd Ritzman, one of the inventors and principals that have led to this tremendous bud that will bring forth fruit in patient-centered innovation and commercialization. And I just leave with you the paradigm: patient to prototype to patient to product. That's what we do in ABIA. And whenever I say ABIA, please remember, it's not just those of us who sit in the building. We're talking about a collaboration. That is what is being celebrated today. Todd.
Thanks, Dr. Douglas. I've been called much worse than Dr. Todman, so that's one of the better. I really, as you know, I'm Todd Ritzman. I'm one of the pediatric orthopedic surgeons in the Department of Orthopedic Surgery at Akron Children's Hospital. And it's with a lot of humility that I'm here. I'm a father of 4, and I'm a surgeon that takes care of kids. And this is really elite air for me. And so I appreciate your time and the opportunity to be here. I'm very excited about this opportunity and what the ABIA has really facilitated. It would have not happened at this point in my career without them. I'll just say that very frankly. I have a special interest and niche in the treatment of pediatric spine deformity. And as such, I'm director of the Department of Orthopedic Surgery's Early Onset Scoliosis Specialty Clinic at the hospital. And I want to read you our mission statement that was written about 18 months ago before any of this was initiated, before Dr. Fenning and I discussed this project. The mission of our Early Onset Scoliosis Clinic is to provide outstanding comprehensive care to patients and families through excellence in the treatment, research, education, and innovation in the treatment of children with early onset scoliosis. And so accordingly, obviously, this opportunity here, facilitated by the ABIA, and certainly with the initiation and help of Dr. Fenning, perfectly aligns with our patient-centered goals in the Department of Orthopedic Surgery at Akron Children's Hospital, and we're really excited about that. So I'm going to spend a few minutes just kind of defining the problem for you, and then Dr. Fenning is going to spend some more time talking about the solution that we're excited about. So early onset scoliosis is a deformity or curvature of the spine that occurs in growing children younger than the age of 9. Scoliosis is very common, and the typical scoliosis patient is older than age 9, so maybe 10 or 15% of patients are in this age group. The typical patient, or a young adult, teenager, adolescent, or adult, can be treated fairly simply with a single surgical procedure, which is a definitive spine fusion, where we correct the spine and fuse the spine. That procedure cannot be done in the growing child because a fusion of the spine immediately halts the growth of the spine. When the spine stops growing, so does the chest and thorax. And you know what lives in the chest and the thorax? The lungs and the heart. And so if a 6-year-old has a spine fusion, their thorax stays a 6-year-old size, and when they're a 16 or 26 or 46-year-old, they have lungs that won't perform the typical breathing requirements of just daily activity. And so because of that, it really poses a unique and very challenging problem for pediatric orthopedic surgeons. We can't fuse young spines, but we have to control the spine. And so the gold standard treatment today is modeled over here on this sawbones model of a spine, or cadaver model of a spine. The gold standard treatment are what are called dual growing rods. And so at an initial surgical procedure, we will do an open surgery and place these instrumentation, attaching to the spine above and below the curve. But then the gold connectors that you can see in the middle of the spine are called tandem growth connectors. And at 6-month intervals throughout childhood, we go back and we make an open surgery. We do admit the patient, hospitalize the patient, anesthetize the patient, make an incision, expose those gold tandem connectors you see, distract the spine, and then set it in the new lengthened position. And so that's effective. That's the gold standard treatment now, and it's effective at encouraging growth, controlling the deformity, and accommodating the spine as the child grows. However, it's effective at great expense. And so, as I said when I introduced myself, I'm a father of 4, and I think the day I stopped practicing medicine, remembering I'm a father, is the day I'm not a good surgeon. And I think most of us have children or have family members with children. And so if you could empathize with the clinical scenario of your 5-year-old child having a 70-degree scoliosis, a large curve, and a surgeon saying, we're going to do this procedure at age 5, 5.5, and 6, and 6.5, and 7, on and on, 9.5, 10, 10.5, 11. We're going to admit your patient to the hospital, anesthetize the patient, do an open surgery with risk of infection, risk of complications, pain, hospitalization, and recovery. Imagine the definition of childhood that family and that child has. It's troubling. It's very difficult. So the gold standard is effective, but there is remarkable room for improvement. And this novel technique that we're excited about, I think, has tremendous implications, tremendous potential to improve that. And so I just want to mention again more along the lines of the appreciation I have towards the ABIA and specifically to Dr. Fenning. This collaboration that was facilitated by the ABA between Dr. Fenning and myself really is unprecedented. I've been at 5 academic institutions in my training and career, and it's unprecedented in any of those institutions. And again, this, I've thought of myself as an innovative surgeon. I've had innovative ideas, but it is extremely difficult for a busy practicing surgeon to innovate, to make this happen. We don't know how, we don't have the facility, we don't have the infrastructure, we don't have the education. And I'll say it a second time, frankly, I would not be here at this point in my career if it weren't for Dr. Fenning first and the ABIA. And so with that, I'm excited to present Dr. Fenning to talk a little bit about the solution. But again, to go back to my dual hat of father surgeon, I hope that this will allow us to have these children have their childhoods defined by school and friends and bikes and family rather than hospitalization, pain, surgery, complications, infection, etc. So, Dr. Fenning.
Good morning. As an engineer and as a scientist within the ABIA, I am grateful that I am able to commit my career towards patient-centered innovation. This is why I am particularly excited to be here today to talk with you about a novel technology that truly fills patient need. Dr. Ritzman has just described the clinical need for better treatment options for early onset scoliosis, and he has spoken about what innovation in this area could mean to both his patients and many others. I'm going to share with you the story of how the technology that launched Apto Orthopedics was discovered and how it works. About 1.5 years ago, I was sitting in an orthopedic conference and I heard the story of the typical treatment regimen for early onset scoliosis, which you have just heard Dr. Ritzman describe. Not only was this treatment seemingly all-consuming for pediatric patients, it was very expensive to the healthcare system. When I heard of this problem, I immediately started thinking of solutions. There was a technology actually from a non-medical application that I had recently seen on TV that used rotating magnets to turn a screw. At this point, I made a match and thought there might be a role for this technology in the treatment of this disease. And I had a few ideas about how to do this. As soon as I returned from the conference, I scheduled a meeting with Dr. Ritzman, who is an expert in pediatric orthopedic spine care. I spent a day with him in the operating room and observed a scoliosis surgery. Afterwards, we sat down and brainstormed about ways to non-invasively adjust spinal fixation systems. The solution that we came up with was a typical example of what we refer to as partnered innovation, which is between a clinician and an engineer. Without this partnership, this idea would have gone nowhere. Soon afterwards, Dr. Ritzman and I submitted an invention disclosure to EBIA and to Akron Children's Hospital. And within a few months, we were fortunate to receive a Technology Development Fund award of more than $14,000 to develop a proof of concept device for this idea. At the same time, the ABIA worked to obtain grant funding to further this idea and many others. Each of the responses from these grant submissions was particularly favorable towards this technology, including one from the FDA. From this, we had some external validation that perhaps we were onto something. For your reference, on the screen to your left is a photograph of one system currently used for pediatric early onset scoliosis. This is the same system that Dr. Ritzman showed you in our sawbones. Our first step in the design process was to make a very simple proof of concept. So I have a few props with me today. Many of them, as is the case with many medical devices, are pretty small. So I do have some pictures to help little bit, but if you want to see actually how they work, feel free to come up afterwards. The idea with this proof of concept device was just to see if we could rotate a screw without actually touching it. So here's our first proof of concept device. Here's a magnet that can rotate. You can see here, as I rotate the magnet, the screw, without touching that at all, rotates. This was all fabricated using rapid prototype technologies. This early prototype was important because it proved to us that we were able to turn a screw without touching it using these magnets. We then went on to a few more functional designs that were significantly larger. Rotate fit. Again, these were done using our rapid prototyping machine. Here's a couple of examples. The engineering design was done by Samantha Stuckey, a senior design engineer within our center, and by Mike Singer, who's a co-op student in our center from the University of Akron. You can see here, this is the 3D computer generated design that they created for our system. After the initial design work was complete, we worked with Akron Tool and Die, which is a local company, to manufacture a working prototype. And you can see that here. And let me demonstrate to you how this works. So this is our most advanced prototype. This piece would take the place of this, you call this that? Tandem connector. Okay. And again, using that same idea with the magnet. I don't know if you can see it, but as you rotate this magnet, you can change the set screw, so you can loosen or tighten the set screw. And that's the basis of this technology. As Dr. Ritzman alluded to, being able to adjust the screw without direct contact enables us to possibly adjust the implant non-invasively. As described, this is clearly preferable for the patient, for the provider, and for the healthcare system. So what's next with the technology? The immediate next step would be to do some mechanical testing in collaboration with the University of Akron and some in vitro testing at Summa Health System. Soon after, we anticipate doing some in vivo testing at NeoMed. At ABIA, we are constantly trying to leverage the resources of our partners. The data from these experiments will push development of the technology and will allow us to compete for larger grants that further develop the technology and lead to commercialization. Dr. Douglas briefly spoke of value-driven engineering, which is one of ABIA's key initiatives. This Apto Orthopedics technology embodies value-driven engineering in that it improves clinical utility, reduces cost to the healthcare system by possibly eliminating several surgeries, and functions with simplicity to the clinician. The innovation process at ABIA was crucial to the success that we've achieved this far. You've already heard that from Dr. Ritzman. In fact, without this process, we would not be here today, and the technology would still be only a scribble in a notebook. It is now my pleasure to introduce Tom Onset, our Director of Technology Assessment and Business Development, to speak a little bit more about this process and what it means to the ABIA, to our partner institutions, and to our community. Thank you.
Thank you, Steve. Please allow me to sort of take us out of that rarefied air that we spoke of earlier. I'd like to talk a little bit about how we arrived at this point, and we often refer to it as blocking and tackling. 18 months ago, the Medical Device Development Center within the Austin Bioinnovation Institute set out to achieve 3 primary goals in support of our partners, all 3 of which would ultimately contribute to job creation and economic development in Akron and the region. Our first goal was to establish or enhance technology development processes within our partner institutions that would allow for ideas to more easily move from what we call a concept to commercialization. When we asked inventors, and Dr. Ritzman alluded to this, when we asked inventors what they had done with their previous ideas, their response would often be, "I didn't know what to do with them, so I did nothing." Implementing and improving those processes, along with the application of ABIA resources, has provided us with the ability and the opportunity to further the development of novel ideas and technologies. And some of those resources that we have here at the ABIA include the ability to assess market potential for technologies that we're reviewing, the ability to look at the intellectual property landscape and determine whether or not that technology is patentable. We have, as Dr. Fenning alluded to, a full staff of engineers, and we are able to apply those resources to those kinds of projects. We have prototype development capabilities,
clinical trial support, commercialization strategy and support, whether it be licensing technologies or, in the case of Apto Ortho, spinning out a technology into a company, and certainly funding. Here at the ABIA, we have what we call the Technology Development Fund, which is a pool of capital that is intended to facilitate the development of novel technologies conceived within our partners and the ABIA that have significant clinical and commercial potential. As Steve mentioned previously, the TDF funds were used, in fact, to further the development of the Apto Ortho technology. Let me address that just a little bit more in terms of what we've done across our partner institutions. In 2011, over $290,000 from the TDF fund was allocated in support of 21 novel technologies, some of which may lead to future startup companies. The development of the scoliosis technology and the creation of Ortho Orthopedics is, as been said before, the direct result of the combination of those processes and the resources that I just alluded to. Our second goal was, and continues to be, to impact the culture of innovation within our partners. In particular, our hospital partners, including Akron General, Children's Hospital, and the Summa Health System. Spending literally dedicated time at virtually every level of those institutions gave us the ability to effectively promote the concept of innovation and market the processes that were put in place to facilitate and manage those innovative ideas. Part of that effort was alluded to earlier and included partnered innovation as well as structured innovation sessions, all of which are employed to identify those unmet clinical needs and then develop solutions to those problems. Our third goal was what we simply call the measurable objective. And that quite simply is and continues to be to dramatically increase the number of invention disclosures or ideas that are generated throughout our partner institutions and within the ABIA. And again, allow me to put that in context. In 2009, there were less than 5 invention disclosures generated by our hospital partners combined. From June of 2010 through December of this past year, 2011, that number increased to over 100 invention disclosures. The number of invention disclosures generated by all of our partner institutions during that same period was in excess of 150, which is a significant amount of growth over the previous many, many years. So we're very, very proud of that, and we expect to certainly continue that. Working directly with each partner over these past 18 months, the ABIA has had the opportunity to gain a better understanding of the capabilities and competencies within each of those partners, as have they of us. And as a result, we are able to identify and facilitate opportunities for cross-collaboration, as Dr. Douglas spoke of, within our partnership on projects like Apto Orthopedics. This kind of collaboration, I know we say it all the time, but this kind of collaboration is at the heart of what the ABIA represents. Apto Orthopedics and the scoliosis technology certainly are impressive examples of how creating an environment that facilitates innovation and encourages innovators can lead to the development of technologies that dramatically improve patient care and provide significant economic development. In collaboration with our partners, the City of Akron, and other institutions and companies in this region, Apto Orthopedics is the first of what we expect to be numerous startup companies developed by the ABIA moving forward. So I would ask that you certainly stay tuned to what's happening within this partnership and within this community. With that, thank you, and I'd like to certainly introduce someone who's well known to all of you, Mayor Pasquale.
I appreciate it. I'm happy to be here today welcoming Apto Ortho to the Akron Biomedical Corridor, and I want to thank Dr. Douglas for inviting me to share a few comments. When I looked at the request, I think what they really wanted me to do was give you the whole history of Akron and how we got to this point. This is the shortened version. I assure you, all of the exciting things that are going on here as people who really understand the difference between the city of Akron, our community in general, Summit County, the partnerships. They really know and understand that we're known as an industrial and manufacturing giant. And most of you in the room probably know just yesterday we opened, helped open ribbon cutting the German advanced manufacturing company for auto parts, Ruschling Automotive, out on Maslin Road. Lately, we've been recognized not only as a city of innovation, but as a startup city, one that welcomes international companies as well as locally grown companies that are out in the worldwide marketplace, creating new products, improving processes, and really a material innovation research and development center. I probably as much as anyone understand the phrase that you use, Dr. Douglas, to product, because I've given you so much credit that you are the one person in the research arena that understands that research for purposes of research is probably very nice. The research for purposes of turning an idea into a product, commercializing that, means better economic news for the community, and in simple matters, it means jobs. So we are very, very happy of this opening, almost, of the first company to begin the process here that we are very excited about and hopeful that we'll see many more, because I really believe we do more to help businesses, and especially as we've worked to encourage through the biomedical corridor and the great work of the partners here at the Bioinnovation Institute to encourage healthcare and biomedical research, including the manufacturing of medical devices. We work hand in hand, Dr. Proenza and his staff at the University of Akron and Frank Douglas with the hospitals that are such great leaders for service to our citizens. And there's no one that's led that effort and been more of an Akron person than Bill Considine. And I want to thank you, Bill, for your leadership. Certainly our partner, Russ